Hello, my name is Dr. Bertha Serwa. I am the president of Ghana Physicians and Surgeons Foundation 2022 to 2023. I want to thank you for the confidence that you've reposed in me to serve, and I promise to execute the job that has been assigned to me. We just returned from our 19th annual conference in Washington, D.C. The executive got to meet with the ambassador of Ghana as well. One of the most exciting things out of the conference was the signing of the Memorandum of Understanding between GPSF and the Ghana Medical and Dental Council, smoothing and greatly expediting the ability of physicians abroad, especially those who did not train in Ghana, for example, to be able to work and be licensed and also contribute to education in Ghana. We are really, really excited about this. Although I signed the document, this Memorandum of Understanding is a testament to the hard work that GPSF has put into place all these years in advocacy and a testament to the hard work of past executives. Sometimes people have said that as an organization they don't see what is going on, but I'm here to let you know that a lot goes on in the background. For example, GPSF is the organization that advocated for the acceptance of the Doctor of Osteopathy degree to be recognized in Ghana, and actually the first in Africa, so that today if you have a DO degree, you can take that license to Ghana and it will allow you to practice. But more importantly, I'm very excited about GPSF at 20, which is going to come up in Washington, D.C. from April 21st to April 23rd. I want you to keep it on your calendar. Block it. We'll plan on early registration, probably starting in August, and I want you to keep the date open and plan to be present and to present something and to be involved in the planning and everything, because it's going to be exciting. It's going to be one of our biggest conferences we've had because we have a lot to celebrate. We're inviting dignitaries, musicians. It's going to be fun. So plan to be a part of it. One of my main thrusts as the president this year is to raise awareness of the existence of this organization, both to physicians and also to the Ghanaian populace. We want every Ghanaian in Ghana and every Ghanaian living in North America to know that we exist. We exist to create value. And then there are other physicians who don't even know that this organization exists. And this year, we're going to change that narrative, because in my mind's eye, I see a sea of Ghanaian physicians scattered all around the United States in various medical specialties, holding hands, working together, and making a big difference in Ghana. Wouldn't you like to hear it if instead of, oh, my mother went to this hospital and didn't get this, or somebody got a stroke and a heart attack, all these stories that filter out. And by the way, Ghanaians are offering great health care. We only hear what is not working. What if we turn all those horror stories into success stories, because Ghanaian physicians abroad came together to go and offer their services, build hospitals, offer to work in our universities and all our hospitals, and we turn the narrative around. That is what GPSF is about, and I don't want you to miss out on that action. Be part of the movement. And to those of you who've been members in the past and maybe just haven't registered, I want to encourage you, go to ghanaphysicians.org/paid-use and activate your membership. That's all it takes. If you've never registered, go on the ghanaphysicians.org/membership and register to be a member, because you know what? This organization is growing. Just before our conference, Dr. Opoku mentioned before, an internist in California became a member. Just in this past week of the conference alone, we've had 5 new members, and I'll mention some of them. They include Dr. Eko Asian, a young resident who's going to start internal medicine in Wisconsin. Dr. Michelle Bossman, starting family practice in Fargo, North Dakota, has joined us. We have Dr. Samuel Ntribu-Esianko from Connecticut, a hospitalist who is joining us. We have Dr. Halm, a hospitalist oncologist in Texas, who has joined us. And we have Dr. Yao Beku, a hospitalist physician in Wisconsin, who has joined us. We are growing. Be part of the movement. And I want you to know that in addition, we have young physicians or soon to be graduates, Dr. Danielle Mensah and Kojo Sapong, who are rallying our physicians and residents. I didn't know there were so many Ghanaians in residency and in fellowship. We have over 500 of them. They're all coming together as an army to join this movement. Be part of it. And now your executives are working hard. You may not see or hear of it, but that's why I'm doing this video, to share with you what we're doing. Since the MOU was signed in partnership with members of parliament who wanted to get the word out, GPSF has been on 15 media platforms. I have had a radio interview with the Ghana Broadcasting Corporation radio. It will be on our website. I've also had an interview with West African Development Radio. We'll put that on our website as well. And I've had a video interview with Dr. James Akins. We were interviewed by the Diaspora Television Network. That is going to be on our website as well. A lot of exciting things happening. Please lean in and be a member. I want you to reach out to your colleagues who are in your state and in your region. Let's come together. When something happens to you, they'll be right there. You have a funeral, you have a birthday. Your chapters will be present to celebrate with you, to support you. Currently, we have chapters in Maryland, Washington, D.C., Virginia, North Carolina. We need chapters to be formed in Nevada, South Dakota, North Dakota, Iowa, Wisconsin, Oklahoma, Arkansas, Arizona, many states. And I want to celebrate the chapter leads who have been present and working hard. Dr. Mamle in Philadelphia, Dr. Shelley Oklu in North Carolina, Dr. Nitete in Connecticut area. But we need 52 chapter leads. Volunteer, send a message to Ghana Physicians USA@gmail.org and let us know that you want to lead in your chapter, because be part of the excitement that is going on. Finally, I want to encourage you to be resilient. You are a doctor. You are enough. Even if you didn't become a doctor, you are still enough. Celebrate yourself. Celebrate your achievements. Sometimes we beat ourselves down because something didn't work or our work hours are so gruesome. And we know that our schedules alone put such a toll on our mental health that it's very easy to succumb to it and get all discouraged. But I want to encourage you that you are more than enough. Your work is really valuable, and count your wins or your successes. Recently I read about something called the law of wasted effort, which it looks like nature and animals have accepted it very well. Except we human beings, we feel if we try something a few times and it doesn't work, we failed. But it's not like that. Apparently, lions only are successful in a quarter of their pursuits. 75% of their efforts go to nothing. Fish eggs are wasted. Most of them are wasted. And if you look at our human beings, a fetus is conceived with a female fetus has about 6 million ova or eggs. By birth, there's only 1 million eggs left. At puberty, there are only 300,000. Guess how many ovulate? Just about 400 of them, or 300 in a lifetime. And then only about 3 or 10 will become fertilized, depending on the number of children a woman chooses to have. The bottom line is, not all your efforts will be successful. So be gentle on yourself. Celebrate what you're able to do. And let the things that you can't do rest, and perform CPR on yourself. That is consistency, persistence, and resilience. These three have something in common: never giving up. Be consistent in your efforts, be persistent, and be resilient. Resilience is the ability to bounce back after a failure. Sometimes you need others to help you, but let's work on CPR this year. Do that for yourself. And as an organization, we're going to be consistent, we're going to be persistent, and we're going to be resilient. I'm so happy to share all that we've done in 1 week with you, and I hope to share more with you. Have a wonderful week. This is Dr. Bertha.